recs for the KDAD's budget. But before we do that, do I have any bill introductions? That deadline passed. Thank you, Jill. Representative Carpenter.
Thank you, Mr. Chairman. I humbly beg your indulgence to open up the KDHE budget that we did yesterday. I discovered, it was brought to my attention that we overlooked a very important part of that budget, and I would ask that, I make that recommendation.
Okay. I have a motion and a second from Representative Ballard. And did everybody hear the request? Okay. So all those in favor say aye. Aye. Any opposed? Okay, Representative Carpenter.
Thank you, Mr. Chair. So we overlooked Project Access, which is an incredible program that these programs are coordinate donated health care with low-income uninsured residents from Sedgwick, Wyandotte, and Johnson County. They serve a lot of Kansas with no health insurance due to limited income, but have serious medical diagnoses that require treatment from a medical specialist. All medical care and treatment is donated by over 2,000 local physicians, hospitals, and medical providers. For $1 of support, leverages more than $15 in donated care, a 1,500% return on our investment.
So I have a recommendation. Do I have a second? Representative Oropeza seconds. Had a recommendation and a second. All those in favor say aye. Aye. Any opposed? Recommendation passes. And I guess.
Thank you, Mr. Chairman.
So at that point, do I need a recommendation to close the KDHE? Okay. All right. Do I need to state that again, Jill? Okay. All right, committee. I move that the Committee on Social Services budget recommend to the House Committee on Appropriations to adopt the appropriations for Kansas Department Health and Environment as amended for FY25 and FY26. Do I have a second? Representative Oropeza seconds. All those in favor say aye. Aye. Any opposed? All right, motion passes. Okay, with that, let's open up recommendations for KDADs. And again, I will say the process we used for DCF was a little different than KDHE was yesterday, and I think today, admittedly, my learning process, what I want to be working from, we have the agency budget, we have the governor's differences, and then we also have the consolidated items from the public testimony request, some of which supported the agency's budget, et cetera. So I'm going to leave it at that. Those are kind of the reference materials that we'll be working on, so I'll open it up for recommendations. So with that, do I have a recommendation? Representative King?
Yep. Thank you, Mr. Chair. I have a ad. I'll just start, and I'm working off of the public, this sheet here.
Okay.
Item number 1, and that is adding funding for a $175 behavioral health add-on payment for nursing facilities for a value-based pilot program capped at 125 participants.
Okay, have the language? Yep. Jill has some language to hand out on that. Question from Representative Oropeza.
And this is for FYI 2025?
2026.
Okay. We're going to go back to 2025?
Oh, I'm sorry if I'm
just asking.
You want me to wait?
Oh.
I have a question on which fiscal year, 25 or 26? 26. Okay. So the question is from Representative Oropeza.
Are we going to go back to FYI 2025? That's you, Mr. Chair.
I thought I shut that off. Well, guess what I get to do? That's also going off in my ear, by the way. So, and that was not a plant. That was very disheartening. So, okay, so would you repeat the question?
My question is are we going to go back to FYI 2025?
Okay, so my question then goes back to, I don't know that we need to on this one, do we? This isn't it for FY '26? Oh. Don't know that we need to do that. Let's go with this one first, and then,
Okay.
and if there are that are specifically rated to FY '25, we can do that.
Okay.
Okay, so I have a recommendation from Representative King. Do I have and we have the language passed out. Do I have a second? And Representative Steens?
Second.
Okay. Okay, so give me 1 second to peer at this. I have a recommendation, a second. All those in favor? Or any discussion, pardon me. Hearing no discussion, all those in favor say aye. Aye. Okay, recommendation carries.
Thank you, Mr. Chair.
Okay. All right, moving on, do I have any additional Representative Wolcott?
Thank you, Mr. Chair. I'll also be working from that same list. Item number 37, I recommend that we add the second year funding, match the funding that we had done last year of $350,000 to continue the grant for the Core Communities Program for fiscal year 2026.
A recommendation from Representative Wolcott, a second from Representative Rivas. Any discussion? Seeing no discussion, all those in favor say aye. Aye. Any opposed? Recommendation carries. Recommendation from Representative Ballard.
I'm the list, 42. At one time, funding to renovate the Stepping Stone Shelter. If you remember, this was the homeless shelter. They served 20 counties. In addition to that, they wanted to remodel the kitchen. And because they have what they would call just a regular small house kitchen. But I think it's 830 SGF. And I think you all heard our testimony about what they're doing, and not only just their town, but it's all those little towns all along the way. So I would move that we approve their 830 SGF for remodeling, as well as the other things they want to do.
Okay, so I have a recommendation from Representative Ballard. Do I have a second? Second from Representative Reese. Any discussion? All those in favor say aye.
Aye.
Any opposed? Okay, recommendation passes. Okay, moving on. I'll go this side. Representative Steens.
Thank you, Mr. Chair. Yes, I would move, and I believe this is item number 40, that we add funding to continue for the MIR program and that is for 1.8 million SGF for the Workforce Development Project. That's number 40.
Okay, I have a recommendation from Representative Steens. Do I have a second? Representative Reese. Any discussion? Okay. A recommendation and a second. No discussion. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. I'm going to get Representative Ballard, then I'll get Representative Rivas.
Thank you, Mr. Chair. Number 12, adding, oh, you want to do it? Okay, I'm sorry. Number 12, I just hit Rivas here. Adding funding to increase CMHC's, the Community Mental Health Grant at $8 million. And maybe many of you don't know, but the legislature established the Community Mental Health clinics many, many years ago when they realized we don't have enough services around the state. So it really is a legislative program that we have. There are 27 different community mental health centers, and anyone, regardless of ability to pay, must be accepted when they go. And if they pay at all, they pay on a sliding scale. And it is part of our legislative process, but also mental health clinics make the difference in terms of rural areas, small, large. And they have been doing their job for years on behalf of the legislature. So I would move the 8 million for the CMHC grants.
I have a recommendation from Representative Ballard, Representative Steens.
Second.
Okay. Any discussions on this? Chair has a question, and this might be the revisor. So this is an addition to SGF, is that correct? Okay, so this is an addition. Can I ask what we're already funding? Because I don't remember that.
Mr. Chair, the total CMHC funding for fiscal years 24, 25, and 26 is 57.6 million. So it's the same amount for all of those 3 years. That comes from a couple of different.
Okay, so this would take it to 64? If it's So I have the Representative Wilcott. Looks like you're ready to ask a question.
Yeah, I'm sorry. Just with that, I'm not familiar enough with the line item. With 56 million already today, what's the additional 8 million? Is it expanding to new territories? Is it adding to existing territories?
I think they're going to rely more on making sure that we cover the uninsured along those lines. They do a minimum on a sliding scale, but I guess if I go back a little ways, at one point, they were cut substantially, and we are slowly building it back up to where they were. And I think this is just to make sure, because there's 27 of them, but they're different sizes, and some are in very rural areas where they can't do their own fundraising, they can't do all that combination of things. And so they get funded based a lot on the needs of the individual communities, health centers.
Any other discussion or questions? So I have a recommendation and a second. All those in favor say aye.
Aye.
All opposed? Motion carries. Motion passes. Okay, a recommendation passes. Any additional recommendations? Representative Oropeza?
Thank you, Mr. Chair. I wanted to recommend adding the 600,000 SGF to continue funding for respite care for caregivers of the individuals with Alzheimer's for FY 2026.
What number, please?
7.
Okay, I have a recommendation from Representative Oropeza. Do I have a second?
Second.
Second, Representative Ballard. Any discussion? All right, I have a recommendation, a second. All those in favor, say aye. Aye. Any opposed? Recommendation passes. All right, let's continue. Representative Reese.
Thank you, Mr. Chair. I'm looking at number 15. That's adding funding for problematic sexual behavior, cognitive behavioral therapy programs for additional training, clinician salaries, and expansion to rural and frontier communities. And the ask is for 1.6 million SGF. And this was brought to us by 3 agencies: Children's Advocacy Centers of Kansas, Sunflower House, and Sunlight Children's Services. And I think, for me, they do fantastic work, but I think for me, one reason why I'm advocating for this is because they're expanding to the rural and frontier communities.
Okay, thank you, Representative Reese. I have a recommendation. Do I have a second? A second by Representative Oropeza. Any further discussion or questions? All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Okay, we will continue. Do I have any additional recommendations? Representative Wolcott.
Thank you, Mr. Chair. This one it's not on this list here. It's actually houses or nursing homes without walls. This is an organization that originally had a Spark grant in 2023 to do some kind of foundational pilot program. They currently have 93 individuals that are still on this program today successfully, but the funding's going to run out. So I'm going to make a recommendation that we add $140,000 for fiscal year 25 and $540,000 for fiscal year 26 for a total of $680,000 to continue this program.
Okay, so to make sure we got the fiscal amounts correct, can you restate those for the 2 years?
It's $140,000 for 25 and $540,000 for 26. So it's a total of $680,000.
Okay, so I have a recommendation. Do I have a second? Representative Oropeza. Any discussion? Representative Carpenter.
Thank you, Mr. Chair, and I've always said this about 2025 budgets. So by the time we get this budget passed, it's going to be May, into May. Are they going to be able to spend that money in the last 2 months of the year? And I always ask people, it comes up in the appropriations process in committee all the time. There's only 2 months left in this year. Are they going to spend that money before the end of the year, or can they wait and take it next year?
It is my understanding, thank you, Mr. Chair. It is my understanding that the funding for the original pilot program will expire and that there's a gap between when that expiration happens and the first part of 26. So the intent is that they will spend this funds in 25, yes.
Very good. Thank you for that.
And thank you, Representative Carpenter, for that, because that is a question that I can assure you the Appropriations Committee has been religiously asking. Representative Ballard.
May I follow up on that, because we will be asked that. Do you know when their funding will expire so that this kicks in?
Representative Wolcott.
Thank you. Thank you for the question. It is my understanding that at the end of March, that the funding will expire in the month of March.
So
Representative Ballard.
when you use the 140,000 in 3 months, because remember, July 1 starts the new year.
That is correct. That is my understanding of the request, yes.
Okay. Any further questions on this one? Okay, I have a recommendation, a second. All those in favor, say aye.
Aye.
A little more teamwork. We got to get this going. All those in favor?
We were thinking.
All those in favor? Say aye. Okay. Any opposed? All right, recommendation carries. Okay, let's move on. Representative Reese.
I'm looking at number 38. And it's to add funding for substance use disorder treatment to supplement the federal grant funding. And that would be adding, well, okay, so when you look at that line item, you'll see two numbers. And it's the $5 million that the Behavioral Health Association of Kansas asked for.
Okay, I have a recommendation. Do I have a second?
If I can get the number, is it 38 or 39? Because the 5 million is 39, the 6 million is, is it?
It's, yeah,
Oh, it's all
there's,
the same.
one says 6 and the other one
I
says
see,
5
I
on that
see, I
same,
see.
yeah.
I'll second it.
A second from Representative Ballard. Any discussion? Representative Carpenter.
Thank you, Mr. Chairman. To sound like a broken record from yesterday, that's just a lot of money, and we've got a lot of priorities here, a lot of asks, and not saying for a minute that it's not important. I'm just saying that it's kind of like when you get your budget at home, you run out of money, you quit spending. So, just saying.
Representative Reese,
I'd like to amend my motion,
please do.
ask 2 million.
Motion, the recommendation has been amended to 2 million. Any, Representative Ballard, are you okay with the amended recommendation?
Yes, I am.
Okay, we have an amended recommendation for $2 million. Any further discussion? Okay, all those in favor of the recommendation say aye.
Aye.
Any opposed? Chair is in doubt. All those in favor, please raise your hand. Recommendation fails. Okay, let's move on. Additional recommendations. We'll go with Representative Oropeza and then Representative Steens.
Okay, thank you, Mr. Chair. I want to add, the recommendation is to add 3.03 million SGF to fund the 988 hotline capacity for FY 2026.
Is there a number, please?
10, sorry.
All right. So I have a recommendation from Representative Oropeza to add funding for the 988 hotline capacity. Do I have a second?
Yes.
Representative Reese, seconds. Okay, discussion on the recommendation.
May I?
Representative Ballard.
Well, 988 is actually housed in Lawrence, Kansas, and part of it is working in that capacity. And we know that that becomes our emergency line, especially for suicidals or any kind of help that they need. And this is I believe, the third year. I mean, time goes, I don't know about 988. It's a valuable hotline, and it really pretty much covers the whole state. So it's not just one location, but it's just where it's housed. So I would support it and ask that you do too, because it is valuable to the whole state of Kansas.
Okay, Representative Carpenter.
Thank you, Mr. Chair, and I think it is a valuable asset, but again, it's a large ask, $3 million. We've got a lot of other big asks, and it's just compounding the ask.
The chair has a question on this one. As it stated, it's add funding for the 988 hotline capacity. What is the current level of funding? Any further discussion on this one? There is funding for it, so this is additional funding. Representative King.
Yes, I would like to know that number before we vote on this, what the existing funding is. $3 million ask. This is in addition to their existing budget, and it'd just be interesting to know what their existing budget is. Thank you.
Okay. Representative Wolcott.
Thank you, Mr. Chair. Kind of along the same lines, but a little bit different. Taking away the dollar signs and looking at coverage, does this expand to new territories, or is this just beefing up the existing territories?
Representative Oropeza.
Thank you for the question. Thank you, Mr. Chair. From what I was understanding and how I remember, I was just trying to click through my computer here, was that would be expanding coverage, because now currently we have some rollover that falls into other states. And not saying that doesn't happen with other states that have 988, but this is to try to curb that, to make sure that we're staying within that if I remember correctly, about 95% coverage here in the state of Kansas. Am I right in saying that? That's the goal, is to keep the calls that come from Kansas in the community base, providers. So not everybody knows what it means to be like rural in the state of Kansas and those types of things, as well as urban. We're just a little bit different.
Thank you, Mr. Chair. I know there's a $10 million transfer for the program. So I couldn't speak to if there is like additional federal funds, but there is a transfer of $10 million from the state general fund.
Representative Rivas.
Representative Oropeza, my question would be, It seems like it's a big jump from 10 to 3 more. It could be a smaller amount. I think some of these could be funded at lower amounts and still give them additional funding to help with capacity. So I would just offer that as a consideration.
Thank you. Thank you.
Warpeza?
Thank you, Mr. Chair. Thank you, Representative Rivas. I would be open if people felt like we could do 1.5,
Okay,
to amend my recommendation to 1.5.
and who seconded the motion?
I
Got it. Representative Ballard.
I am fine, I would go with that.
Okay, so the recommendation has been amended to 1.5 million. Any further discussion? Representative Steens.
Thank you, Mr. Chair. Can someone remind me, I'm so sorry, Representative Ballard, I know you mentioned it too. What all does the hotline do? It covers all the rural areas and that's for emergencies like behavioral health and everything, or what does that cover?
I'd have to really look at it. This hotline covers a lot. For those of you who don't know, at one point, well, we had an area code. We had to completely, for that 2 years, block out a complete area code, 913, to make room for 988 to be able to take all the calls and be the hub.
Okay.
Right. So it could be suicide. It could be somebody who really depression. It could be a combination of people that just are having a hard time doing whatever it is. To leave it open, to be able to respond and have people be able to identify calls, return calls to those locations where before we weren't able to do all of that.
Thank you.
If there's additional things, please add, because I don't know all of them. I just know some because I worked with them a little bit.
And if, sorry.
So I do see a phone a friend out in the audience, and she's, I would ask, indicate as if you want to come up and answer the question about the coverage. Madam Secretary, thank you. Probably not what you're planning on doing today.
Laura Howard, Secretary for KDADS. Yes, so through 988, and there's a state coordinating council, the Deputy Secretary Brown from KDADS chairs. We fund the call centers in the state that include headquarters in Lawrence. We also now have 4 call centers that answer those 988 calls across the state. And so again, they answer those calls. They may talk to a person who's having a mental health crisis. Sometimes all it needs is that phone call and that conversation. Sometimes there might need to be a different action. So then they can make a connection, for example, to route a mobile crisis unit from a community mental health center out, those sorts of things. The program is funded through a demand transfer that was included in legislation a couple years ago. It's a $10 million demand transfer. And at this current time, I mean, we feel we didn't recommend any changes in the funding source for fiscal year 26 beyond that demand transfer. Based on our expected needs. But again, that's what it does. I think there's lots of things to consider in the future that have to do with, expanded technologies, integration, intersections between 988 and 911. So there will continue to be more work to do in this regard, and certainly, more investment could be valuable. It wasn't one of our requests just based on the current demands for the line so far. So thank you.
Thank you, Secretary Howard. Committee, any further discussion or questions? Okay. Representative Carpenter.
I can't remember if I spoke against this one or not. So,
You did.
okay, just wanted to make sure. Sorry
I
about
started to say, yeah, you did, no, you didn't,
Okay, so, and we do have an amended recommendation, correct?
Yes, Mr. Chair, we have an amended recommendation of 1.5.
Okay, so I have a recommendation, been amended. All those in favor say aye. Aye. Opposed? No. Chairs in doubt. All those in favor, please raise your hand. All opposed? Recommendation fails. Okay, let's move on. Have any additional Representative Steens?
Thank you, Mr. Chair. So this is from my one yesterday. It's on line 36 for the brain injury waiver increase. That was for fiscal year '26 to raise the unit rate up from 18.99 per hour to $25 an hour. And that was to add the SGF for $2,490,730,000. And then the all funds to $6,226,825,000. I'm assuming we need to read both those figures. So that was for cognitive, physical, OT, speech, and behavior therapy,
Okay,
or Minds Matter.
committee, I have a recommendation. Do I have a second? Representative Reese, seconds. Discussion? Representative Carpenter?
Mr. Chair, so do we have a fiscal note on that? What was the fiscal note then?
So originally, they had asked for 30, and that was a little bit larger amount, so I asked for the 25 instead yesterday. Do you want me to read the?
Well, what was the fiscal note on the 25?
The SGF was $2,490,000, $2,490,730.
Mr. Chairman, I renew my opposition to some of this stuff. I'm not saying one bit that it's not a good thing. It's just we're piling up dollars, millions of dollars.
Committee, additional discussion? Okay. We have a recommendation on the table. All those in favor say aye.
Aye.
Opposed? Recommendation fails. All right, let's move on. Representative Oropeza.
Thank you, Mr. Chair. I have a recommendation to add 500,000, including 250 SGF, and add language for request for information for active management of the IDD and PD waiver list for FY 2026. Oh, sorry, 30.
Okay, committee, I have a recommendation. Do I have a second?
Yeah, I'll second that.
Representative Ballard, seconds. Okay, discussion. Representative Carpenter.
So what would this do?
So from my understanding, when I asked questions about it, it would triage the people who are actually on the wait list to really make sure that those people who are needing services now get the services now, and the people that are just kind of put on the wait list because there is a wait list, to make sure that we're appropriately triaging those persons to make sure they're having access to care activities.
Thank you for that. Has the department asked for this?
I see the secretary shaking her head no. So the KDADS has not asked for this one in particular. So and what was the
250.
250 on this one? Okay.
And I renew my opposition.
Okay. Any further discussion on this one? Okay. Have a recommendation and a second. All those in favor, say aye.
Aye.
All opposed? Recommendation fails. Let's continue. Further recommendations. Representative Reese?
Sorry, Mr. Chair, I may have to have phone a friend here. I can't find the testimony, and I've lost it here. Number 17, the Kansas Hospitals, Hospital Association. Tara May's here. There she is, way back there. Okay, I may need Tara's help. The funding for the county hospital reimbursements at 3 million. And Tara, correct me if I'm wrong, but this is the fund that is used when the county and hospitals county jails and hospitals have to hold the person until a slot is open at the state hospitals. Is that correct, Tara? And law enforcement. Okay, good. That's the right one. So there, we have been funding this at 3 million of SGF. And I'm asking that we continue to do that. The county jails have really, of course, the hospitals too, but I've heard more from the county jails that they have been utilizing this funding a lot, because there are times when people are waiting 2 weeks, 3 weeks, maybe a month, maybe more, before there's an opening at a state hospital for them to be able to be transferred to. So they're having to stay in the hospitals or in the jails, and this funding is just to offset the cost of being able to house that individual. So I'm asking for the full 3 million.
Question, Representative, what number were you working on?
I'm sorry, 17.
Okay, thank you. Okay, I have a recommendation. Do I have a second?
I'll second.
Second, Representative Oropeza. And discussion. Representative Carpenter.
Thank you, Mr. Chairman. So what's the balance in that budget, and how much have they been using?
Hayden?
Mr. Chair, in 2024, the total expenditures were 1.4 million. So there was a balance forward of 3.6 million that was lapsed by the agency. I would note HB 2007 includes funding at $5 million for this item. So that amount is in the Legislative Budget Committee recommendation.
Okay, so then this is an additional 3 million to that 5 million?
My understanding is that the agency, or they were requesting at least 3 million. I would defer to them as requester.
And we asked Tara? Mr. Chair? She's back there. She's way back there.
Tara from the Hospital Association, would you care to approach the mic? Tara Mays.
Mr. Chairman, thank you very much. Tara Mays with the Hospital Association. Yes, we wanted to make sure that at least $3 million was captured in both fiscal year 26 as well as fiscal year 27. So we just wanted to make sure to flag that $3 million is the minimum of what is needed.
Okay, thank you, Tara. So Dayton, can you restate?
Yes, there is 5 million in 2025 and 2026. For this budget, we don't go out to 2027. Typically, that of course would be up to the committee, but there is money for 25 and 26 at $5 million.
Okay, committee, further discussion? Okay, you've heard the recommendation and discussion. All those in favor say aye. Aye. All those opposed? No. Recommendation fails. Okay, let's move on. You're working with a lot of stuff. I'll give you a minute to find your place. Representative Oropeza.
Thank you, Mr. Chair. I wanted to make a recommendation for the Nutritional Services Incentive Program and add 1 million for Nutritional Services Incentive Program grants to offset the decrease in federal funding and to reduce the wait list put in place by nutrition providers based on the prior funding level for FY 2026. Oh.
Number 6.
Sorry, number 6.
Okay, committee, you've heard the recommendation. Do I have a second? Second, Representative Reese. Discussion. Representative Carpenter.
Thank you, Mr. Chair. I think this is a good recommendation. We heard testimony during the process that the federal funds had been cut, and this would backfill those federal funds.
Committee, further discussion. Representative Ballard? Nope. Okay. No further discussion. All those in favor say aye. Aye. Opposed? Recommendation passes. Representative Ballard?
Thank you. It's item 43. I would like to add $250,000 in State General Fund for Ember Hope Youthville for aftercare services for FY 2026. This would be what we call our PRTF. This is our youth program and for treating youth. And this aftercare is after they have been at Ember Hope, there's a 6-month program afterwards for aftercare where they meet with the student or the child that they have and their parents to follow up to make sure that they're doing well. Just so that you know, when we start talking about PRTF, at one point there was over 800 and some slots, and over the years we have fewer ones. We're someplace around 400 and some, and we're very limited in youth for their after care away from their homes, but at the same time, they visit with their families because they have a place that families can come in over the weekend, and they can work with the family and the youth. And we're in need of more youth places, and the 250 would allow this aftercare for like 6 months after to make sure that the youth are doing well as an adjustment with their families as well.
Thank you, Representative Ballard. Any further discussion? I have a recommendation and a second. All those in favor say aye. Aye. Any opposed? Recommendation passes. Continuing, do I have any further recommendations? Representative Carpenter.
Thank you, Mr. Chair. Couple of things. Dayton, is that $45 million worth of federal funds in 2025 or is it in 2026? 25. I would make a recommendation that we grab that federal money. It's $45 million worth of federal money that was for the HCBS waivers. Yeah, it was years ago when COVID was going on, we had an increased FMAP the money could only be spent on HCBS waivers. So that fund was lapsed earlier this year in the budget process. It can only be spent on HCBS waivers. If we don't latch onto that money, it's going to have to be paid back to the federal government. So I would make a motion that we pull that $45 million. And I know I got it earlier today. I know KDADS has a very inclusive list of things to spend that on. So anyway, that's my motion.
This is similar to what we did yesterday, I believe.
Exactly.
Okay, so I have a recommendation. Do I have Representative Ballard seconds? All those in any discussion? Representative Carpenter.
It's not on any list. It's,
I remember it, but
I'm lucky it's even in my head. So.
The streamline tool didn't catch everything that it was needed to do. So I have a recommendation, a second. Any further discussion? Representative Orpeza?
I have a question, Mr. Chair. Thank you. Representative Carpenter. So will this help with the SGFs that were recommended to allocate to like the frail and elderly and the TA? Is that what you're saying? The $45 million will be used for that, or is that something KDADS will take care of?
Yeah, it's different than that.
Oh, it's different than
It can
that.
only be spent on the waivers, but they've got a whole list of things that they can spend it on. I know originally one of the big things that we did was we spent $50 million on bonuses to the employees and providers. So it's limited to what you can spend it on.
Okay, thank you. Appreciate that.
Okay, I have a Representative Reese.
Representative Carpenter, just for further clarification, in the budget, the KDADS is asking for funding for the FE, the TA, and the BI waivers, just so that there isn't a wait list. Do you think they'll be able to use that money for this?
I'm not sure that they can because that's an ongoing expense, and a lot of the waiver money that we're talking about with the increased FMAP was one-time money, and we were pretty adamant about only making it one-time money and not continuing on. You'd have to ask KDADS about that, but I believe that's correct.
I'm trying to see if there's at least 3 other recommendations
I think to answer
to
your,
address those 3
to
waivers.
your first question, I think Representative Carpenter, based on the head nods that I saw from our friends from KDADS, is he answered the question correctly. So restate your question, please, Representative Reese.
Well, there, in the budget, there are 3 items for funding requests, for the FE waiver, the TA waiver, and the BI waiver. And, you know, can ask for recommendations for all 3 of those unless they're going to get covered under the 45 million.
So if I may, I'm not going to step out of the chair, but if your question is about the waiver enhancements for what's 32, 33, and 34 on this list, what I would make a question to Dayton is, these are enhancements to the current waiver? So are you asking about what current levels of funding might already be there? I'm trying to interpret the question correctly.
No, I'm asking if the 45 million would cover the enhancement request in 32, 33, and 34.
I think Dayton?
Mr. Chair, Representative, I'm about to send an email to you all. KDAD's provided a list of the projects. They have allocated the $45 million already for a list of projects that required CMS approval to sort of improve the HCBS system. That was the purpose of the funds. So it would not be used for those enhancements.
Okay, that is your question. I've lost track of where we are. Is there a recommendation on the table? Okay. Thank you. Okay, have a recommendation and a second. All those in favor, say aye.
Aye.
Opposed? Recommendation passes. All right, continuing. Representative Carpenter.
Thank you, Mr. Chairman. Last year, as a budget proviso, there was caps put on the ID and DD wait list and also the physical disability wait list. I will be happy to tell you that this does not involve any money. This is policy. Our wait list right now is currently at 4,300 and some change, and I don't remember exactly what the PD one, but the caps that I would like to put on are $4,000 or $4,000 for the ID and DD wait list and $1,800 for the PD wait list.
So a recommendation and a second by Representative Ballard. Discussion on the recommendation. Okay. All those in favor say aye. Aye. Opposed? Recommendation passes. Okay, continuing. Representative Carpenter.
Thank you, Mr. Chair. Item 16, add $2 million in SGF funding from the telehealth services for students and delete $2 million SGF from the mental health intervention team program for 2026. The MHIT and this program, I believe, serve the same purpose, which is mental health in schools. And so if we're wanting to get telehealth mental services in schools, I think that's a logical place to get the $2 million.
Okay, I have a second from Representative Reese, pardon me. Committee discussion or questions? Representative Rivas.
Just help me understand, we're basically going to eliminate one place and put it in another place. What if we didn't do this, just left it where it's at? I mean, so tell me what's the reasoning?
Well, it could be considered a duplication of services, quite frankly, but in the absence of that, it does this the MHIT program is mental health in schools. Great program, have no problem with that. I'm just struggling with how to fund money and Ben's the telemarket. It's telemedicine, mental health in schools. I'm just trying to offset that versus asking for $2 more million. So.
Okay, Representative Wolcott.
Thank you, Mr. Chair. Just to make sure I fully understand, this has a net effect of zero. You're funding it with funds that are already allocated or existing?
Correct.
Okay, thank you.
Representative Reese.
I just want to add to the discussion that the MHIT, or the mental health program, that's intervention teams that are within the schools, they have more work than, I mean, they have a lot of students that need services. The community mental health centers that are involved, the FQHCs that are also involved, there are private therapists that are also involved, and yet we don't have enough. We don't have enough providers to provide the services. So this is where Hazel Health would really come in handy. They'll help to fill some of those gaps.
Committee, any further discussion or questions? Okay, I have a recommendation, in a second. All those in favor say aye.
Aye.
Opposed? Recommendation passes. Okay, continuing, committee. Representative Carpenter.
My recommendation involves the TA, the specialized medical care hourly rate. And it would raise it from the current $50 an hour to $55 an hour in 2026. As many of you have followed this or have followed this over the years, the TA waiver, and this is the nurses that do that, they keep our folks out of the hospital. And it's that simple. It really saves money in a big way. If these folks don't have the care that they need, they're going to be in the hospital. At the current rate of hospitalization, we could be talking $10,000, $12,000 a day. And this is, what did I see? 1.7 million SGF. So that's my motion.
We have a recommendation. Do I have a second? Second, Representative Ballard. Discussion or questions for Representative Carpenter? Seeing none, all those in favor of the recommendation vote aye. Aye. Opposed? Recommendation passes. Okay, committee continuing. Representative Carpenter.
I'm sorry about this, monopolizing things. These are just a lot of things that were on the list. Add language to increase the lottery machine vending transfer cap to $12 million for 2026. Jill has a handout there for the committee. Gosh, I've forgotten how many years ago it was. The lottery vending machines were set up, the profit for those went towards mental health projects. And this would fund partially the Breakthrough Club, I believe, and then another mental health grant, if I'm not sure. The Breakthrough Clubs and another mental health project. I'm not sure exactly. I can't remember that, what it is. So it's a crisis stabilization and the Breakthrough Clubs, or the clubhouse model. And I might add that there's no SGF involved. This is lottery money, and it was it's been in the budget. We've increased it this year. I think it was in the budget for $10 million last year. So this is just an increase of what we've been doing.
Okay, committee. Representative Reese seconds it. Ask Representative Rivas.
Just a question on the proposal we have in front of us. It was 16 million on the one document, but you said 12 million. So clarify.
Yeah, that was an ask from a person that testified. I think this is reasonable.
So Representative Carpenter, I have a question. And I think I heard you say there was, that the ask was 8 million or something like that? Or did I hear that wrong?
The ask was 16, going to 16.
Okay.
There's no reason why I haven't, other than I don't like to push the envelope. And if we don't get any pushback for another couple million more than we had last year, then I'm probably okay with not jeopardizing the whole.
Okay, thank you for the answer. Committee, any further questions or discussion? Representative Reese.
I just want to add too that with the clubhouse model, they're currently in Wichita, Hutch, Olathe, Topeka, Newton, and Salina. And this funding would allow them to expand to Hayes. There are 4,830 people that could benefit from this in Hayes, and 3,674 individuals in Great Bend who could also benefit from the clubhouse services.
Thank you, Representative Reese. Committee, any further questions? Committee, we have a recommendation and a second. All those in favor, say aye.
Aye.
Opposed? Recommendation passes. Committee continuing. Additional recommendations? Representative Carpenter.
So now we're getting into the big items that we've been trying to say that really are important. Just to get the little one out of the way, my recommendation would be add 2.5 million, including 983,750 SGF to fund a partial year's cost of the implementation of the community support waiver.
Can you restate that?
Yeah, it's item number 29 on the, but it's add 2.5 million, including 983,750 SGF to partially fund a partial year's cost of the implementation of the community support waiver.
Second from Representative Oropeza. Committee discussion, questions for Representative Carpenter? Seeing none, all those in favor say aye. Aye. Any opposed? Recommendation passes.
Thank you, Mr. Chairman, and thank you for not indulging me, because most of the folks in this audience know I could speak for an hour on this subject. It's a little near, it's a little near and dear to my heart. So, anyway.
Representative Carpenter, you have another recommendation?
Item 26, add 35 million, including 13.6 million SGF to add 500 individuals from the ID&DD wait list to the ID&DD waiver for 2026.
Representative Rivas seconds. Committee discussion. Carpenter.
So this continues our path to lower the wait list. We have been on a mission. It's very expensive, but I think we've got buy-in from the legislature. It's not just this committee, but our entire legislature is committed to lowering that wait list into manageable numbers, and this just continues that process of, we did 500 last year, we're doing 500 this year. With KDAD's help last year, I think we took almost 1,000 people off the wait list, if I'm not mistaken, because just from our 500 and then just the attrition from that. So we're getting it down to manageable numbers. I think that it's not I'm not going to say what I'm going to say. So anyway, anyway, I'm done.
Representative Ballard advised that you could speak an hour on it, and that's probably true, but that's testimony to your commitment to this. So,
That was complimentary.
I know that. I know that. Committee, we have a recommendation. We have a second. Any discussion? Okay, all those in favor say aye. Aye. Opposed? Recommendation passes. So committee, continuing with recommendations. Representative Carpenter.
Thank you, Mr. Chairman. I'm sorry to monopolize this. It just needed to be done, and I know I can explain my way out of most of this stuff. So with that, I would add language to rebase the rates for the program for all-inclusive care of the elderly to 90% of the amount otherwise that it would have been paid for 2026. And I'll wait till I get a second, and then I can do an explainer about.
Representative Ballard seconds.
So, Mr. Chairman, with your permission, I'll explain that. The PACE program is a program that we've tried to incentivize for the last, I don't know, 4 or 5 years. The basis of it is to keep people out of nursing homes. And for folks that have been around a long time, it's been doing a really good job, but they also have increased costs. But we still save, it's 90% of the amount that would have been paid otherwise by the MCOs or something and serving that person. So it's been a really good program, and it's kept a lot of people at home, and I don't have to tell you the quality of life issues between home and a nursing home. So with that, I
Stand for questions, if there are any.
will.
Okay. Committee, any questions? Okay, we have a recommendation and a second. All those in favor say aye.
Aye.
Opposed? Recommendation passes. Representative Carpenter.
Thank you, Mr. Chair. I do have a couple of more, just really small items. One, the smallest one is add 68.6 million, including 29.3 million SGF for the add-on payment for, for the add-on payment for nursing facilities based on the Medicaid residents at a rate of $20 per day. So it's a Medicaid add-on for $20 a day, and that's paid per Medicaid bed that a nursing home serves.
Do I have a second first, and we'll have explanation? Second from Representative Ballard, and then you had a question, Representative Ballard?
I just want him to explain that again, because sometimes I understand it, then the way he said it this time, I don't know, was it different?
So it reimburses the nursing homes for $20 extra per day for each Medicaid patient that they serve. Last year's budget was a $15 increase. This year's budget is a $20 increase. You saw the amounts. You know, I don't have to tell this committee or anybody in this audience the danger that our nursing homes are in. And they're struggling every day with increased costs, employment situations, all kinds of stuff. And, you know, I just rail on this because every time a nursing home closes, it'll never open again because it won't be grandfathered in and it'll have to meet the new regulations and all that kind of stuff. So we've just got to do all we can to keep our nursing homes open. Our baby boomers are turning 80 this year, I believe it is, and the needs are going to be even greater than they've ever been.
And just a question, Representative Carpenter, the impact or the fiscal note on this was what?
SGF portion was 29.3 million, and the all funds amount is 68.6 million.
Thank you, Representative. Committee, any other questions or discussion? Okay, committee, you've heard the recommendation and the second. All those in favor say aye.
Aye.
Any opposed? Recommendation passes. Representative Carpenter.
I have one more.
Is it little?
I promise. No, yeah, it's little. It's really small. And there's a typo in this. And so, Dayton, just for clarification on the rebase, I can't find my sheet, but I don't think that's correct there on line 2, item 2. I don't think that's correct, and I'm not in all my papers here, I need to dig out my, hang on just a second and I'll dig it out.
Committee, while Representative Carpenter is looking through that, encourage you to scrub through everything that you have in front of you to make sure we haven't missed anything. Look at that. Representative Carpenter.
Thank you, Mr. Chairman. So the rebase for 2026 is 17.7 million SGF, 45.3 all funds. And yeah, there's.
Yeah. Representative Rivas seconds. Okay, so while Dayton is working through that, Representative Carpenter, you care to provide some clarification?
So in statute, KDADS is, and it's in our statute, I can't remember the year, but it was in the 90s, I believe it was, but it allows for the rebasing of nursing homes on actual costs every 3 years. And so it's a 3-year running average of the costs of the last 3 years. And I believe we're going to estimate this year here because the survey that has the amount, and Brad probably knows, but he's been doing a great job of estimating what it would be into the future because we don't have the cost report back at this time. And so, but it's within just a couple of $1 million, the total. And it has been going down because COVID is dropping off. So, you know, in the 20s and 21, you know, and COVID, it was really high. It was like 85 million, all funds. And so it's been dropping because those cost reports have been dropping down. But that's the basis of it is it's a way for the nursing homes to cover their actual costs.
Committee, any questions for Representative Carpenter or question about the recommendation? Okay, seeing none, all of those in favor of the recommendation say aye. Any opposed? Recommendation passes. Okay, committee continuing. Representative Carpenter has tapped out. Representative Rivas.
I have a question first. On number 19, the SIBF fund, those improvements, are those funds SGF or are those
No.
funds from some other source?
Representative Dayton, you want to give a primer on the SIBF? It's the Strategic Investment Business Fund, I think, is the state institution. Too many acronyms.
Mr. Chair, the State Institutions Building Fund is how those capital improvements at the state hospitals are funded. It's not state general fund. It comes from a mill levy. And happy to answer any further questions you might have.
Representative Rivas.
So what is the balance in that fund now? Do we know that? I guess my question is, if they've got the money and they need to do the improvements, why don't we fix the places up? We need to keep the physical properties up. And their ass didn't seem out of line.
Mr. Chair, Representative, the balance and the number I'm going to give you is the governor's recommendation, the ending balance based on her recommendation. However, to my knowledge, there have not been additions beyond the governor's recommendation that would deplete the resources of that fund. So the ending balance in that fund was sufficient to carry the balance. It carries, you know, I think it was $14,000. Basically, if all of the governor's enhancements in her recommendation were adopted, that would be the ending balance. And as you'll recall, most of those enhancements were deleted in the LBC recommendation.
So where do we go with that, I guess I'm asking.
So I guess what I would just kind of remind the committee is that, so the purpose of what we're doing here today is building committee recommendations to take to the Appropriations Committee. So we'll take the combined effort from today and previous day's work, and we'll present. Some of that may survive. All of it may. I mean, that's what happens in appropriation. After that, the budget will be put back together, and then and I'm going to quote Chairman Waymaster, that's when we start working the budget for anything that may have lapsed or reappropriation. It's kind of rebuilding from there. So that is the next step. So not everything, and just for edification, if you follow what's happened the last 2+ weeks in appropriations, not everything that was on the governor's budget request sheet has made it through. So there are items that at this point I would say are still unresolved. But the next step beyond us is appropriations and then consolidation of the budget. And also whatever the Senate is cooking up. Representative Reese.
Just to add to the discussion, this committee declined to add that $3 million to help the jails and the hospitals when they're holding people to go into the state hospital. And if we're not going to look at more improvements to the state hospital, then, you know, we're hitting a wall here, you know, with that. So I contend that if we aren't going to be able to, you know, like appropriations isn't going to approve the capital improvements for the state hospital, then we need to revisit that $3 million again.
Okay, so is that a recommendation?
Yes, it is a recommendation.
Okay, it sounded like one.
Yeah.
I have a recommendation. Do I have a second? Second from Representative Ballard. Okay, and your recommendation is, if you could please restate that.
Yes, if appropriations is not going to approve the enhancements and as asked for, it's a big number. It's 11.1 million for the capital improvements to the state hospitals. Then we need to revisit the ask for the 3 million for the county and hospital reimbursements.
Okay, Representative Carpenter. Oh, wait. I have a second. Do I have a second on that, or did I have a second? Okay, and then, okay, so discussion, questions, Representative Carpenter?
So we've already heard that there's $5 million in the budget. You know, they're not, and they used, what, 2 million, Dayton? They use $2 million a year. That's how much they spent last year. There's $5 million in this budget, which that leaves them $2 million left this year, and they're going to get another $5 million in 2026. It's already in the budget. I fail to understand why we would need more money than what they would actually spend. And I will remind Representative Reese that this committee started that because we felt like it was unfair for the jails and the hospitals to be housing our folks in there. So we started that. And I'm just saying, and I think we've adequately funded that so that they can access that. I see no reason to add more to it when they're not spending it and just sit there. We have a lot other fish to fry besides that. So that's why I would oppose this.
And I partially agree with you, Representative. The 3 million here is to, I think it's to assure that at least 3 million, I know there's 5 million in the budget that was originally asked, but for this committee to at least approve 3 million, so at least 3 million, you know, because the thought is appropriations is not going to approve the 5 million, but if they could at least approve the 3 million, and this fund is still very new. You know, they've only had a year, maybe. It's been 2 years now. And I know that the reimbursements has been very slow to get to the hospitals and to the jails. So I know there's an ending balance there, but I'm not sure that is a real number. I think it's been utilized even more than that. So I'm just asking that if we're not going, if the appropriations is not going to approve the funding for the building enhancements, then at least to make sure 3 of that 5 million for the hospitals and the jails is approved.
So I had a recommendation and a second. Had some discussion before we get into either a vote. I want to give Dayton a chance to correct the state institution building fund balance. He's got additional information on that.
Yes, thank you, Mr. Chair. Sorry, I was looking at the Correctional Institutions Building Fund. The governor's recommendation, the ending balance for the State Institutions Building Fund for 26 would be $7.7 million that would be available for 2027, the beginning.
So Representative Reese, does that change your recommendation or not?
No, it does not.
Okay. Okay, so we have a recommendation on the table in a second. Any further discussion? All those in favor of the recommendation say aye. Aye. Opposed? No. Recommendation fails. Okay, continuing. Representative Rivas.
In light of that, I think I would like to make the recommendation on, number 19, to state hospital capital improvements, but I'd like to make the dollar amount $5 million. I just feel like you've got to repair your property. You got to maintain things.
Okay, so we have a recommendation to add funding for state hospital capital improvements of $5 million SIBF. Okay, that's the recommendation. Do I have a second? Second, Representative Reese. Discussion? You want to add to that, Representative Rivas, at all? You want to add to that at all? To the recommendation, any discussion? Okay. Okay, we have a recommendation and a second. All those in favor say aye. Aye. Opposed? No. Recommendation fails. Okay. Committee, continuing. Do you have any further recommendations? Seeing none. All right, seeing none, I move that the Committee on Social Services budget recommend to the House Committee on Appropriations to adopt the appropriations for the Kansas Department of Aging and Disability Services for FY 25 and 26. Have a second? Second, Representative Orpeza. All those in favor say aye. Aye. Opposed? Motion passes. All right, folks, thank you a lot. It's been a lot of work the last few days. This is not the end by any means. I see Representative Ballard shaking her head. There's a lot of work to do in appropriations and the budget process from there. A lot of homework in the next couple of days. And before we adjourn, just FYI, we will be working one bill next week, hearing tentatively on Tuesday. The agenda will come out, but just kind of note that if you were thinking you're going to get the entire week off, it'll be a light week, but you won't get the whole week off. Okay, with that, folks, we are